The number of children with autism is way up, according to the Centers for Disease Control. It now estimates that 1 in every 88 children is autistic. Take a look at how quickly the rate has shot up. In the year 2000 and 2002, it was about 1 child in 150. 2 years later, 1 in 125. Then 1 in 110. And now the latest report from 2008, 1 in 88. That's a 78% increase over the last decade. But why? Our chief medical correspondent, Dr. Sanjay Gupta, with us now to help answer that. Sanjay, frightening to parents to hear those dramatic numbers. Do we know why such a dramatic increase?
Part of it is probably because we're paying more attention to autism than ever before, and so there's greater awareness and, as a result, also greater detection. But even if you account for that, the numbers still seem to have increased. People always say, John, it's a combination of genes and environment. But I will put this forth, and that is that, our genes in our human bodies, they don't change that fast. They wouldn't account for a 78% increase over 10 years. It takes hundreds of years for our genes to change, so it's definitely more environment. Toxins, infections, exposures. It could also be that parents are having kids later in life, and as a result of that, that could be a risk factor, or the fact that the parents themselves have accumulated toxins in their bodies, and that could be the risk factor.
And the costs are astronomical. Researchers say as much as $3 million over a lifetime. Do most health insurance plans cover this, beginning to end?
I don't think most insurance plans cover this. A lot of the cost, on a family is out of pocket. It's a huge toll on couples. There's, I think, close to an 80% divorce rate, for example, among couples who have a child with autism. So it's a huge toll.